Hello, my name is Sierra Smith, and I'm here to discuss the mutations of alpha-2 Chimaerin that result in Duane's retraction syndrome, which can be shortened to the acronym DRS. This molecular story is pretty personal given that I actually have DRS. DRS is a congenital disorder, meaning it's present at birth. It is caused by the failure of the nerves to properly send signals, innervate ocular muscles that control lateral eye movement. The disorder comes in three varieties. The first type, which I have, is characterized by limited or absent ability of the affected eye or eyes to abduct, which means to move outward. If you look at the picture to the right, the bottom picture shows exactly what happens when I try to gaze left. As you can see, my right eye normally moves inward, but my left eye does not have the ability to abduct. If you compare this to normal abduction of my right eye, you can notice the difference. Because of this, I have limited peripheral vision in my left eye, and I enjoy overusing the joke that I am blind. The second type is characterized by limited or absent ability of the affected eye or eyes to adduct or move inward. And finally, the third type of DRS is characterized by limited or absent ability of the affected eye or eyes to abduct and adduct. So your eye is basically just stuck in one position. I'm one of the very lucky 0.1% of the population affected by DRS, most of this group consisting of girls, and as shown in the picture to the right, my left eye is affected much like the rest of DRS patients. While patients are commonly diagnosed when they are around 10 years old, when they become more aware of their limited eye motion, I was actually diagnosed when I was 2 days old. DRS causes the affected eye to so slightly retract into the skull, making the affected eye appear smaller than the normal eye. The nurse caring for my mom in the hospital after I was born noticed one of my eyes was smaller than the other, and the nurse was apparently familiar with extremely rare ocular motility disorders and suggested I be tested for DRS. Coincidentally, my family happened to live within a few miles of one of the top DRS specialists in the nation, so I've been seeing her since I was about 2 years old. The cause of DRS is mutations of the alpha-2 Chimaerin protein, so I'm first going to explain how normal alpha-2 Chimaerin functions. Alpha-2 Chimaerin is a regulatory protein that regulates levels of a molecule called RAC bound to GTP, which I'll be discussing on the next slide, don't worry. It's located in the cytoplasm of the cell and exists in a closed conformation, meaning that its binding regions for RAC and the lipid diag have limited accessibility. By regulating RAC GTP levels, alpha-2 Chimaerin controls the process of neuron growth and development. RAC is a signaling protein that is active when bound to GTP. RAC signals neurons to continue growing and developing, so when RAC GTP binds to alpha-2 Chimaerin and becomes inactive RAC GDP, neuron growth and development stops. This allows neurons to grow to a very precise length so they are able to reach their target muscle and send signals correctly. The next few slides are visuals of the process of alpha-2 Chimaerin inactivating RAC GTP. In this slide, the location of alpha-2 Chimaerin in the cytoplasm is shown. As you can see, the lipid diag is binding to its binding site on alpha-2 Chimaerin. After diag binds to alpha-2 Chimaerin translocates to the cell membrane and the protein essentially opens up to expose its RAC binding site. Now that the RAC binding site is exposed, RAC GTP binds to alpha-2 Chimaerin and becomes inactive RAC GDP. As displayed in the animation, the abducens and oculomotor nerves grow. This occurs while RAC is bound to GTP. When they reach the correct length they need to be in order to properly connect to the lateral and medial rectus muscles to control lateral eye movement, they stop growing. The growth would stop when alpha-2 Chimaerin inactivates RAC GTP. In the case of my type 1 DRS, my abducens nerves impacted, affecting the innervation of the lateral rectus muscle. In this animation, however, neuron growth occurs normally, so the nerves are able to correctly send signals to their designated muscles. This picture displays an individual in which the process of normal inactivation of RAC GTP occurs. Lateral eye movement is not inhibited. When alpha-2 Chimaerin does not function correctly, this is caused by 7 main mutations. These mutations occur as a result of mutations to CHN1, the gene which encodes alpha-2 Chimaerin. The mutations can be categorized into 2 main categories: mutations that disrupt the closed conformation of the protein, which are displayed in green on the 3D model to the right, and mutations which disrupt binding sites on the protein. These mutations are colored in shades of blue on the displayed 3D model. In the 3D model, structural features such as alpha helices are displayed in pink, with variants of helices displayed in purple, and beta pleated sheets are displayed in yellow. If you take a look at the 3D model displayed on the screen, you'll notice how close the amino acids affected by conformational mutations are to each other. Normally, these amino acids interact with each other in order to essentially close the molecule and deter exorbitant amounts of DAG and RAC to bind to their respective binding sites. However, due to these mutations, the protein is not completely closed anymore, allowing DAG and RAC to more readily bind to their binding sites. The result of the increased ability of DAG to bind to alpha-2 chimerin is increased translocation of alpha-2 chimerin to the cell membrane. The mutations to the binding sites of RAC and DAG are gain of function, meaning they simply enhance the normal function of the binding site. The increased accessibility of both binding sites, in addition to the hyperactivation of the sites, leads to increased translocation of alpha-2 chimerin to the cell membrane, as previously mentioned, and then in turn, greater rate of RAC-GTP binding to alpha-2 chimerin and subsequent inactivation of RAC-GDP. The main effect of the mutant alpha-2 chimerin is therefore greatly reduced levels of active RAC-GTP within the cell. The picture displays a 3D model of alpha-2 chimerin. 3D printing the protein and highlighting its mutations greatly helped me to understand how the amino acids within the protein interact with each other, and therefore how the mutations of the protein impact its structure and function. The following diagram displays the result of hyperactive mutated alpha-2 chimerin. Given that levels of RAC-GTP are greatly reduced by hyperactive alpha-2 chimerin, the growth of the abducens nerve normally caused by RAC-GTP either does not occur or is prematurely cut off. When this occurs, the abducens nerve either fails to exist or is extremely deformed. In the bottom picture, take note of how the deformed nerve does not make contact with the lateral rectus muscle. There's that little gap there. When the nerve is missing or is not the correct length, the lateral rectus muscle is not properly innervated, so abduction of the affected eye will be very limited or absent. Below is a side-by-side comparison of normal eyes and my DRS affected eyes. If you compare the bottom picture in each compilation of pictures, you will notice that the normal eye fully abducts, while my DRS affected eye only slightly abducts. Therefore, the individual with full abduction will have unrestricted peripheral vision, where I am left with a small blind spot in extreme regions of my peripheral vision of my left eye. Unfortunately, DRS has no corrective treatment given that missing or deformed ocular nerves cannot be replaced or fixed. However, some individuals with DRS unfortunately have misaligned eyes due to improper activation of ocular muscles. When this occurs, in order for the individual to maintain binocular vision, meaning the vision of both eyes is not overlapping, the person will have to tilt their head to align their eyes. To eliminate head tilt and realign eyes, a surgical treatment has been developed. Displayed in the picture, the individual in the top picture would be a candidate for alignment surgery given that both eyes do not look straight forward while the individual is face forward. Notice the adduction of this eye before the surgery when the individual is simply looking straight forward, and the lack of adduction after the corrective surgery. I can fortunately say I have never been a candidate for alignment surgery given the mild nature of the misalignment of my eyes, but alignment surgery can be extremely helpful for candidates pertains to. While many parents are nervous when their child is diagnosed with DRS, especially given the limited general knowledge of the disorder, DRS is not a debilitating disease. I am able to drive with the aid of special mirrors, and DRS has never prevented me from competing in sports or aligning myself with others, even those to my left that I cannot see, in marching band. I was once asked what I would change about myself if there were only one thing I could change, and the person asking this question was surprised when I did not say DRS. Especially given that I was aware that I had this disorder at a very young age, DRS is just simply part of who I am. It doesn't greatly impact my life, and the odd way I can cross my eyes is just my go-to party trick. I hope you learned a lot of information on DRS and alpha-2 chimerin from this presentation. Thank you.